Today, we're diving deep into the complex genetics of Niemann-Pick disease, and more importantly, we're exploring actionable prevention strategies. It's a fascinating, if incredibly serious journey into how our bodies actually work at a microscopic level. But beyond that, it's about how we can protect our future generations. Let's get right into it.
Here's our roadmap for today. 1. Hidden genetic threats. 2. Autosomal recessive inheritance. 3. Inside Niemann-Pick disease. 4. Clinical management and care. And 5. Prevention and prenatal testing.
Starting with Section 1, Hidden Genetic Threats, the Invisible Risk.
Think about it for a second. It's super easy to track the things we can actually see, right? You know if you've inherited your mom's eye color or your dad's height. But we so often completely overlook the silent genetic risks passed down through generations. These are traits that literally don't show up in a mirror, but they are sitting right there, coded into our DNA.
To really put this into perspective, let's look at a different genetic condition for just a moment. Thalassemia in Pakistan. A staggering 5.4% of the population there. We're talking about 12 million people are carriers. Millions of people just walking around, living their everyday lives, completely unaware of this hidden genetic threat they carry.
And you know, this perfectly illustrates the real danger of genetic diseases. The definition of a carrier. A carrier is, for all intents and purposes, a perfectly healthy person. They are 100% asymptomatic, absolutely zero signs of illness, but they carry one defective abnormal gene. Because they look and feel entirely fine, this hidden threat can literally only be detected through specific blood screening.
Moving on to Section 2, Autosomal Recessive Inheritance, the Math of Genetics.
So what happens when a carrier man and a carrier woman have a child together? Well, the biology follows the incredibly strict, almost mathematical precision of autosomal recessive genetics. It breaks down like this. There's a 25% chance their child will be completely healthy and gene-free. There's a 50% chance the child will be a carrier, exactly like the parents. But, and this is the critical part, there's a distinct 25% chance of the child inheriting the defective gene from both parents, resulting in an affected sick child.
Now, I really want to emphasize this next point because there's a huge misconception out there. People often think, okay, if one child is affected, the next one must be safe, right? Actually, scratch that. That is completely false. This 25% risk does not decrease. It resets with every single pregnancy. And just to be clear, autosomal recessive inheritance doesn't care about gender. It affects boys and girls equally.
Which brings us to Section 3, Inside Niemann-Pick Disease, when cells fail.
Let's look at how this disease actually destroys the body, starting right down at the microscopic level. First, the cells literally lose their ability to process lipids and cholesterol. Because the cell's normal waste disposal system completely fails, fat starts building up to unbelievably dangerous levels. This massive accumulation eventually crushes the function of vital organs, leading to a massively enlarged liver and spleen. And tragically, it causes severe, irreversible damage to the brain and nervous system.
Now, while they all share that same core metabolic failure, Niemann-Pick actually manifests in 3 very distinct types. Type A is just fast and brutal. It typically shows up in infants around 3 months old, marked by severe brain damage, an enlarged liver, and stiff muscles. Type B, on the other hand, usually affects toddlers between 2 and 4 years old. These kids present with pneumonia, abdominal fluid, and enlarged organs, but they actually experience less severe neurological impacts. And then we have Type C. This one is specifically caused by a deficiency in the proteins that transport cholesterol. To make matters even more complicated, sometimes patients can present with mixed symptoms from types A and B.
Let's move to Section 4, Clinical Management and Care, Navigating the Reality.
Getting a proper diagnosis involves checking for those enlarged organs, running blood tests, and doing MRIs. But 100% confirmation, that always requires a specific DNA test. And this leads us to a really harsh reality. We have to be brutally honest here. Right now, there is no absolute cure for Niemann-Pick disease. Medical intervention is entirely focused on supportive, multidisciplinary care, purely to make the patient as comfortable as possible.
This kind of comprehensive care protocol requires just immense, round-the-clock dedication from families and medical teams. They use enzyme medicines to manage the physical organ swelling, which definitely helps with breathing, but crucially, these meds do not repair the devastating brain and nervous system damage. Because of that, families have to rely on intensive daily therapies. We're talking physical, occupational, and speech therapy just to help the child with basic functions like walking, swallowing, and communicating. all alongside specialized soft diets and regular oxygen therapy.
On top of all that routine care, strict emergency protocols absolutely must be in place. Patients need immediate antibiotics to aggressively treat inevitable complications like pneumonia. They require specific medications just for seizure management and targeted pharmaceutical treatments to alleviate incredibly painful muscle stiffness and cramping. As you can probably imagine, managing the sheer weight of this is a severe mental and financial test for any family. Ongoing support is absolutely critical. Finally, Section 5, Prevention and Prenatal Testing, Securing the Future.
So, knowing all of this, the absolute best defense is carrier screening before or right after marriage. But if both parents are already identified as carriers, let's look at the timeline for the next step: chorionic villus sampling, or the CVS test. This timeline really demystifies what sounds like a terrifying procedure into a fast, clinical process. Around the 12th week of pregnancy, a doctor uses an ultrasound to guide a tiny needle and extracts a small sample from the placenta. The entire thing takes maybe 3 to 5 minutes. And then, within 10 to 15 days, you have a conclusive DNA lab report in your hands. Now, it is important to weigh the realities here. There is a tiny calculated risk, about a 1% chance of miscarriage associated with the CVS procedure itself. It requires a couple of hours of hospital observation and a day of resting up at home. But look at the reward on the other side: 100% definitive knowledge about your child's genetic status. Having this conclusive report allows families to make informed, timely decisions, potentially avoiding the devastating, incurable reality of Niemann-Pick that we just talked about.
I'll leave you with this final thought for today's explainer. We've seen firsthand just how destructive this invisible genetic threat can be, but we've also seen exactly how we can stop it. Awareness and early screening are, without a doubt, your absolute greatest powers. So if a simple blood screening can secure your family's genetic future and prevent a lifetime of incurable suffering, why wait to get tested?